that was quite great, and it's actually my pleasure to give an overview of this section. Specifically, the section is about Efanesoctocog alfa and a novel factor VIII agent, which was based on the relationship between factor VIII and von Willebrand factor, and the extent is for the prolongation of the half-life of factor VIII. So IFA has the advantage of prolonging the half-life of factor VIII. And so this section basically is a kind of an interim analysis of the extended phase III XTEND trial, which in which patients were started on IFA. And so in this session, it is the interim analysis of the extended study. And in the first study, it involved 146 patients with Hemophilia A, adults and adolescents. And they were rolled over from the first trial. And the outstanding result was that these patients continued to maintain very low annualized bleeding rate, and of very great importance is that none of these patients so far developed inhibitors, and the bleeds, the control of bleeds was quite great with just one infusion of IFA. So that was quite great indeed. And then the second was on children. Again, it's a rollover study, it's a continuation of the first extend study, and is an extended study, so to speak. So it's an interim analysis of patients that were rolled over into this study. And it's, so far, 74 patients were recruited, and they were all younger than 12 years. And they had IFA weekly. And the result was that, again, there was no inhibitor development in these patients, as well as the great reduction in the annualized bleeding rates. So both of these studies actually showed that the IFA continues to maintain its effect in reducing annualized bleeding rates and also in preventing inhibitor development in these patients. And also very important is the safety that is quite well tolerated even in the extended trial. And of the third session, abstract was on the presentation was on the use of bypassing agents in Hemophilia A with inhibitors, and of course knowing the actual dose of bypassing agents that could be used. And in about 34 patients were recruited into the study, and their maximum coagulation function was measured at the onset, before the infusion of the bypassing agent, and the particular agent that was used was recombinant factor VIIa, and after, so immediately after, before and then after a breakthrough bleeding, and then before a surgical procedure. And then they were able to come out with the fact that none of these patients developed thrombosis, and they concluded that the standard dose of recombinant factor VII at 90 microgram per kg was quite safe in Hemophilia A patients with inhibitors that are being treated with Emicizumab.